Hi, I'm Dr. Nishana. In today's video, I'll be discussing about differences between MD and DNB. If you're someone who has finished their NEET PG and is still confused between MD and DNB, this video is for you. So we'll be discussing the differences between the two under various sections. In the last segment, I'll also talk about my experience as a DNB. First of all, we'll be discussing a little bit about the history and basic differences. In India, earlier we had only MD seats which were run by various universities across various states, which had very non-uniform pattern. And later on, we had the requirement for large number of specialist doctors. At the same time, there were many institutions, private sector as well as government sector, which had large caseload and very good infrastructure, which could be a potential site for training young doctors, but couldn't become a medical college. So NB in 1975 introduced DNB to combat the scarcity of doctors as well as to bring uniformity in medical training. Even now, DNB is run by NBE. DNB is a centralized training that is run by NBE, but MD is still run by various universities across the nation. If you're joining for DNB in the institute, you will be training in that particular institute, but your academics, your examination, everything will be under the control of NBE. So even if you are joining in that institute, you will be directly dealing with NBE rather than that particular institute. First of all, we'll go into the differences between training in MD and DNB. Though both are considered to be equal nowadays, there are a lot of differences in training in these two. First thing is clinical exposure. In government medical colleges, of course, you will have large number of cases, large variety of cases. You will have good clinical exposure. If you're considering MD in a private medical college, you should be a little bit more cautious because in some of the private medical colleges, there will be lesser patient load. And if you're considering a specific course in a specific private medical college, you have to inquire about that specific course in that specific medical college because in some of the private medical colleges, some of the departments will be well established, but some of them may not be. So you have to inquire about that as well. The problem of clinical exposure is much more in DNB because it depends upon the institution much more than these government medical colleges. Some of the DNB institutions will have large variety of cases, large number of cases and a good clinical exposure. But this varies from one institution to other when compared to the MD in government medical college. So the thing is that if you're considering a private medical college or if you're considering DNB, you have to inquire about that particular college very specifically about the very specific department regarding the caseload as well as case variety. Next thing in clinical exposure is the exposure to the recent advancements like recent technologies, recent drugs used in your specific specialty. That will be much more good in DNB Institute because this might be, in most cases, it will be large corporate hospitals which will have most recent diagnostic and therapeutic techniques, the most recent drugs. So your exposure will be much more in a DNB hospital when considering these things. In government medical colleges as well as private medical colleges, some of these centers will be run under low resources, not all, but some of them will be run under low resources. So they will have a scarcity of these recent advancements or drugs. So that is a problem with the MD. But there are MD institutes with exposure to recent technologies and drugs. So you have to inquire prior about the exposure to the recent advancements and drugs as well. The third thing in clinical exposure is exposure to super specialties. So most of the government medical colleges, there might be few super specialties which might be well developed, but some of them may not be. And DNB as well as private medical colleges. So this varies from institute to institute, but some of the DNB institutes, which especially those in private sector and those belong to the large corporates, will have well-established super specialties. So the exposure to super specialties also need to be considered. If you're considering MD or DNB and the institute that you're considering does not have exposure to super specialties, you have to ask them prior or inquire prior whether they give a distant posting or exposure to super specialty in another center. I think this is mandatory because we need exposure to them, and these days super specialization is getting more popular compared to the past. So while discussing each and everything, I'm asking you to inquire about that particular institute, because each of these things will vary from center to center. There is no perfect center to train, so you have to inquire about that particular institute and that particular branch in that institute. The next thing in clinical exposure is academics. So in MD in medical colleges, we know they have been running MD courses since forever. They will have very good structured academic plan, regular classes, seminars, symposiums, everything will be conducted. And the faculties who will be working in these medical colleges will be very much interested in teaching you. Though the NB has published a detailed syllabus for each and every specialty, this is not commonly completely followed because of the caseload or lack of a structured academic plan. And the faculties in these DNB institute might not be as interested as these medical college faculties to teach you. And a lot of self-learning will be required if you join a DNB institute when compared to MD.
Another thing to consider is about the hands-on training. Actually, I have lost the video clip of this segment. In government medical colleges, obviously you will get good hands-on. In private medical colleges, you have to see the caseload as well as number of PGs. If there is less number of cases and there is more number of PGs, the hands-on training might be very less. In DNB Institute, the hands-on training will vary a lot more than these medical colleges, because some of the DNB Institute, especially in private sectors, will not give adequate hands-on training because the management and the patients will not be encouraging that because they belong to the private sector. So you have to inquire beforehand about the hands-on training available, especially if you're choosing DNB or MD in a private institute.
Next, we'll discuss about the training environment and the toxicity. If you're joining in a government medical college for MD, you can see that there will be large number of seats. You will have many co-PGs. You will feel that you are still in your college days. But in DNB, the seats might be lesser, so that collective feeling may not be there. Sometimes you might feel isolated, but in MD also, even if there are a lot of people, sometimes the work might get you isolated as well. And then about toxicity. Everyone is asking about toxicity. So toxicity doesn't depend upon whether it is an MD or DNB institute. It is there in both MD and DNB. It depends upon the institute as well as the people in the department. So this can vary from place to place. As I have said, you have to inquire about that particular college, the toxicity in that particular department specifically before joining. So an advantage that I felt about DNB in this specific area is that if you join the specific institute, you are directly under NBE for your training and your examination. And even if you have any grievances, if there is any toxicity or any problem in the department, you can directly go talk to NBE and they will surely address your grievances. NMC is also having the grievance cell. But I feel NB is very much accessible and very much interested in solving your problems. Then about examination. In MD, the examination is conducted by that particular university which your college belongs to. And the theory and practical examination will be conducted in your own institute. Attending practical examination in your own college, that's a great boon in MD. You will have familiar cases, familiar faces. You will have your internal examiner who has seen you through the last 3 years, your hard work, your learning, everything. It will be appreciated by them. So, and the familiar environment itself will give you some positivity. A problem with this familiarity is that if you have any problem with the department or the internal examiner, God forbid nothing like that happens, but if you have something like that, your examination, your passing and your score will be affected. In DNB, the theory and practical examination is conducted by NBE, which will have a uniform pattern. Every candidate throughout the nation going for that particular examination will have the same theory paper and same OSCE during their practical. Your theory and practical examination will be conducted in a different institute. Sometimes it might be in a different state. So if you're going for their examination, that is okay. If you're going for practical examination, you will go to a new place, a new hospital. Sometime it might be a new state. You might not have any idea about what cases are coming. You might not have any idea about the language. So it will be very unfamiliar. So that unfamiliarity can cause anxiety, and the person who's coming for examination might judge you from a very small interaction. So the hard work you have put, even if you are very good throughout the 3 years, you have learned very well, and you had some problem during that short period during the examination, you might be in trouble. So that's the thing. The unfamiliarity, the new cases, the new things all can create a little bit of problem. And about the difficulty in passing and passing rate, everyone says DNB examination is very tough and the passing rate is very low. I myself did DNB. I did not feel like it's a very tough examination. It is difficult, but anyone with a decent preparation throughout the 3 years can easily get through the examination, the theory as well as practical. And about the passing rate, everyone says the passing rate is very low, but exact passing rates I could not find in NB website or any official website. There are a lot of other websites which says it is 50 to 60, 60 to 70, but I don't know whether it is correct. I don't think it's good to look at the passing rate, because as I've told, it's not a very difficult examination that you can't get through. You don't want to know whether the other people are passing or not. It is 90% or 98%. If you are good at your work, if you have studied for 3 years, you will easily get through it. Then about the stipend, the government medical colleges pay a decent stipend that varies from state to state. You can inquire about the particular state and college. And even though it is good pay, I have heard there can be delays. And in private medical colleges, you have to be very cautious, because some of the private medical colleges I've heard, they list it as a very higher number, but they cut a lot of money from your stipend, stating so and so reasons, and they delay it. So you have to inquire about that particular medical college before joining. In DNB, the NBA has published the minimum amount of stipend to be given to the first year, second years and third years. So that will be followed by your institution. Sometimes you might get much more than that. If you don't get paid like that, you can always contact NBE. Then about bond, the government medical colleges will have a bond period of 1 to 3 years depending upon state to state. So you have to inquire about that particular state. In DNB, generally the bond will not be there, except for some of the railway hospitals, some of the ESI hospitals and state funded hospitals. So you have to inquire about the bond details. You can find it in the NB website. You can go through the institution's details and then opt for the institution. Then we will discuss about recognition and career opportunities and limitations. Both DNB and MD are considered to be equivalent now. If you're applying for a permanent academic post with the DNB, you might require a SRship of 1 to 3 years. And regarding job opportunities in private sector, if you go for a job, you cannot find any difference. If you look at any listings, you can see that they're asking for MD or DNB in that particular specialty. There is no difference as much as I know. After I finished my DNB and I was looking for jobs, I couldn't find any difference. And if you're planning to go for super specialization, various fellowships, DM or MCH, both are considered to be equal. MD or DNB in particular specialty is the eligibility criteria. And in some of the foreign fellowships, the DNB candidates are more preferred currently, because these foreign nations prefers a more uniformly trained, as well as those candidates with decent exposure to the recent advancements, as well as exposure to protocols and working in a more organized environment. My take as a DNB. I did DNB anesthesiology in one of the largest corporate hospitals in South India. We had large number of cases, large variety of cases, a good ICU, and there were super specialties, neuro, cardio, transplant, pediatric, and all of the advanced surgeries including robotic surgeries were done there. And we had decent exposure to all these. We also had the most recent, most advanced workstation and drugs, UST machine, everything. We also had a decent exposure to them. And everything done in the hospital was according to the standard protocol by ASAH or other bodies, and the training environment was decent. Okay, we had large caseload, so we had the workload. It was a bit hectic, and even though that was hectic, I was able to tolerate that, because in the end I feel it's better to have a bit hectic in residency. Then about academics, we had classes going on, but not very regular when compared to MD, and a lot of self-learning was required. But learning and academics was always supported by the department. We were always encouraged to go for all the conferences and participate in all CMEs, quizzes, etc. We were very supported. It was, in total, the academics was very well supported, but not very structured, so required a lot of self-learning. And one thing I felt is that since we had that number of cases and exposure to all those things, and also because we had followed the standard protocols while writing the theory examination, I felt that the lack of a little bit of academics was compensated by very good caseload. Then about bond, I did not have any bond. Then the stipend, I got a stipend which was around twice the amount of stipend instructed by NBE. And after training, when I was searching for job opportunities, I did not feel that I was any less of any other MD candidate. I was considered to be equal in all the jobs. And after joining job, I did not feel that my knowledge or my skills were any less of any other MD candidate. So in general, I feel good about doing DNB in the center that I chose. I think I have discussed almost all the aspects of differences between MD and DNB. If you have any other queries or anything I have missed, you can ask in the comment section, or you can directly contact me through the mail or Instagram ID that I will be listing in the description box. I hope this video has added some value to your life. See you in the next video. Bye.